Well, welcome everyone, and welcome to all of you down under in New Zealand and everyone up there in the Arctic who is listening to us, and from coast to coast in Canada and the US. For our conversations with McGill OSS and Emily Shore, our communications director and whatever else title she wants to give herself, is with us. And a very special guest today is Professor Tim Caulfield, who is the research director of University of Alberta's Health Law Institute. And he's also a Canada Research Chair in Health Law and Policy, and the author of several books. The one that really got my attention first was Is Gwyneth Paltrow Wrong About Everything? The answer, of course, to that is yes. But the new edition of that book is going to have a different title. It's called The Science of Celebrity. So welcome, Tim. And maybe to get us started, you can tell us a little bit about what the University of Alberta Health Law Institute is and what the mission is.
Well, the Institute has been around for a long time, actually since the 70s. And it really started as sort of a classic health law academic center where we looked at, pretty classic health law things. And it has evolved since then to really an interdisciplinary entity that, I like to think that what we try to do is look at what the empirical research says on a topic, on a health topic, and tease out how we should move forward. So now we have really an interdisciplinary team. We work with linguists, we work with public health experts, we work with scientists, we work with communication experts, to explore what the science, what the evidence says on a topic, and how the policy should move forward. And Joe, as you know, what's happened over really the last decade is a lot of our research, a lot of our expertise now is in how science and health is represented in the public sphere. And we've started to do more and more research on misrepresentations, on what I always call bunk, and how we can debunk stuff, and how we can make sure that misinformation isn't doing real harm. And as we know, holy cow, it's doing a lot of harm.
Well, we live in the age of information and misinformation, and the amount of each of these that comes at us every day is like a tsunami. I'm scared to even open up my email in the morning because of all the flood of both sense and nonsense that is out there that we have to separate. And of course, these days with COVID, all of this has intensified. The amount of legitimate research is just astounding. Although I must say it really surprises me how little we have learned since the beginning. We've been at this now seriously for 4 months, with thousands and thousands of studies coming out about every aspect of this. Fact is, we hardly know more than we did at the beginning.
Yeah. It is interesting, Joe, and I think that you're right. The amount of research is amazing. I don't know if you saw recently, I just tweeted over 60,000 peer-reviewed articles since January, 10,000 preprints, an amazing amount of research going on. And Joe, think of the money that's being poured into this. And so what I think it illustrates is, let's say the good news is how the scientific community can be mobilized on a topic. I mean, that's good news. But I think it also illustrates, and Joe, you know this so well, Emily, you too, science is hard. It's really, really, really hard, especially when you're talking about something as complex
and evolving all the time.
Constantly evolving,
yeah.
Right?
Yeah. It's very hard to be conclusive about anything. Everything has some element of controversy about it. Like we, of course, in our discussions here have been following the hydroxychloroquine story.
Yeah, same.
From the beginning when, Trump started urging everyone to give it a try, what harm is there? And then, of course, we quickly found out that there is possible harm. But it's been batted back and forth because studies come out, one seems to show some benefit. There was one yesterday that the White House is now trumping, and it is because they showed some reduction in mortality, but this was an observational study where the patients were also being given steroids. So you don't know what it is. And unless you have the proper randomized controlled double-blind trials, you really can't come to any conclusion. But there's so much ink spilled over all of these studies, and the social media picks it up, and sometimes it's unnerving what you see out there. There was this video that I came across and posted of these anti-maskers. Now, there's a new term that is anti-vaxxers. And this, I think, was in Florida, where these women were saying the most outrageous things about masking. That God gave us the ability to breathe. And how does man have the idea that you can impair this breathing? And then, of course, the highlight was a woman that says that she doesn't wear underwear because
I saw it too.
Various parts of her anatomy have to breathe.
Joe, I was really impressed, though, that they were able to tie the mask debate to pedophilia, to sex offenders, and to going commando. I mean, that was impressive.
Right. Yeah,
They're
very creative. Yeah.
A lot of ingenuity out there. Unfortunately, it's misapplied, right? Yeah. Okay, well, let's talk about some specifics, because there's so much misinformation. And what are you now finding is the biggest challenge? What are you having to deal with the most?
I think that, and I'm curious if you guys agree with this. So when the pandemic emerged, there was this belief, and I even said this, that I think this is going to cause people to trust science more, to show that scientific information is valuable. I think I said, Joe, a ton of times that I hope one of the legacies of this pandemic is a greater appreciation of science and a greater appreciation of the harm that misinformation can do. I think that I'm still hopeful, but I think because of things like the hydroxychloroquine debacle, because of some of the communication around masks, what we're seeing, and there's some research to back this up, is a decrease in trust in science. Now, in Canada, the numbers are still very promising when you're talking about, do the public trust science and public health officials, but globally, we're starting to see this erosion. And why I think that's really problematic is, when I'm in the media and when I'm talking to people publicly, I would say, go to those trusted voices, go to the World Health Organization, go to the Public Health Agency of Canada, go to the CDC. But because of how science communication is being handled, you're starting to see this erosion in those entities. So I'll say that, and then I'll immediately get a pushback saying, I can't trust those voices, right? I can't trust scientists. I can't trust how it's being communicated. So I think it's a very good illustration how incredibly important it is to get science communication right. What you guys do, right? What you guys do to get it right. And I think, and Joe, you touched on this earlier. I think it also highlights how important it is to be honest about the science and be transparent about So I have a piece coming out in the Globe and Mail this weekend where I argue that we can still, get a public health message out there that has traction, that's honest about the science. And I think we need to do that, right? We got to, because if we don't, we're going to polarize the debate further, and I think we're going to do long-term harm to how people view science. Because we have these retractions happening in respected journals. We have things like the hydroxychloroquine debate, and we can go, talk a little bit more about that. And we have the media representing things in sort of hype terms. I really think we need to get how this is communicated right, or we're going to do long-term damage.
Absolutely. I think one mental image that I like to project is of a balance. You take your scientific studies and you put them, on the balance. Some will be pro and some con about whatever issue. But eventually, there'll be enough weight on one side of the balance to, and that's
the weight of evidence approach, right?
Yeah. And eventually it comes down to scientific consensus. It's never totally certain. I mean, science is like a race towards a finish line, right? But that finish line is always going a little bit away from you. But unfortunately, people who are not well versed in science can be misled. Like you listen to the U.S. politicians now who say, "Oh yeah, well, how can we really trust Anthony Fauci? At one time, he was telling us not to wear a mask, and now he's telling us to wear a mask, and therefore everything else he says must be also wrong." Right?
Oh, it makes my head explode. I think I hear that argument every single day, right? That you were wrong about masks in February. and now you want us to wear a mask, so therefore the entire public health system is wrong. When on the contrary, that's exactly what you want public health officials to do. You want them to be nimble. You want them to respond to emerging evidence. That's them doing their job, right? So, and the problem is that people frame it as if evidence that science. I'm sure you've heard this too, that somehow science is wrong. Science is not a list of facts. That one fact makes science wrong. But it is. But to be fair, this also goes back to how it's communicated, right? So if you communicate science as in a dogmatic way, and in a way that makes it sound like there is no wiggle room, and then you change your mind later, it does make those kind of views more intuitively appealing, right? It makes it easier for them to say, well, you were so dogmatic in February, and now you're,
That's the thing is, we cannot really be dogmatic in science about almost everything.
Yeah, I agree.
When I say almost, we can be dogmatic about homeopathy.
Yeah, there's a couple things, right? Even vaccines, I think, there is this weight of evidence, right? There are these topics where you can use stronger language. Sorry, Joe, go ahead.
And the thing is that science is a self-correcting discipline, right? There are errors that are made, but eventually they get corrected. But pseudoscience is not self-correcting. They keep using the same arguments over and over again, and it never changes. So the fact that in way back in March, we're saying that it's not so important to wear masks, in certain environments, and now we see it's more important. It's because evidence has been accumulated since that time, and we're always basing it on the latest knowledge.
Well,
and
knowledge. I don't know if you follow like the Ontario or Ottawa Public Health on Instagram or something. I find they have been so good and transparent about why it is things are changing. So this was the first they posted. I have it in front of me an Instagram post on mandatory cloth masks and now it's mandatory there, and why things have shifted since March, basically. And they said, things are shifting because the evidence changed. Is this going to be the final decision forever? Probably not. We'll probably have to change it again. Is this going to eradicate Corona in a month? Probably not. We'll have to change it again. But be patient with us. We are doing what we can for you. It was very impressive, and just to show that we are also we're human and we're following the science, and this is why. This is the point of science. And I think it allowed people to be like, thank you a little bit. I don't know why people really just want black and white. They don't understand that middle ground at all.
Emily, you also raise a really interesting point when you say, they're human. There's an interesting body of evidence emphasizing that if you're communicating and you do it in a way that's authentic, right, in a way that is humble, you're actually, in a way that's not aggressive, you're more likely to be viewed as credible, right? Yeah. So if you're not just a talking head reciting data, but rather you are a human being who does research, or a human being who's also kind of struggling with the data, trying to figure it out, you're more likely to be viewed as credible. Now, that evidence, it's hard to research that kind of thing well, right? And there's some evidence that points in the opposite direction, that tone doesn't matter so much. But I do believe that in the aggregate, what you just said is really important, right? Let's communicate in a way that matters. And what I think the good news is, and I wonder if you both agree with this, you're starting to see that more. You're starting to see science communicators getting creative, using humor, using images, using stories to get across the good science. And it's exactly what you want to see happen.
I also do think it's different. It's important to distinguish between Canada and the US in this case. I mean, usually you could say, we're all developed and we're all the Western nations and we follow, similar, but right now there is a clear distinction. And I know that, communicating science is still a challenge in both countries, obviously, but there's very different attitudes, I think, towards science at this moment.
There is.
I think that some people look on science as if it were the ultimate solution, that if you follow science, you can know everything, right? Which is also not true. Not everything is knowable. Not everything can be studied because life is just so complicated. There's so many variables. There's so many confounding factors. When people ask, well, exactly how far can those viral particles travel? Well, you can't give a definitive answer to that because there is no real study that you can mount that will give you a conclusive
and
answer.
so many variables.
Yeah, that's variables is the bane of science, right? And confounding factors, and it's very difficult to rule those out. Like I've had over the last couple of days several questions asking, what's better, a mask or a face shield? So what do you do when you get a question like that? You of course look through the scientific literature to see who has studied this, and no one has actually studied this because it's almost impossible to study this. So you're left to looking at some information that is out there and some logical thinking. I mean, obviously, when you have a cellulose acetate or a polycarbonate shield, nothing passes through that, but stuff can pass around it, right? It's open at the side, it's open at the bottom. So if someone were to directly sneeze on you, yeah, the face shield is better. If you're sitting somewhere in an office where you don't have proper ventilation, I don't know if the face shield is better than the mask, because the mask is tighter on your face. Each one may have its own positive aspects and negative aspects. I don't even know how one would design a study, to do this. I mean, put people in a room and put someone who's infected and have half of them wear a mask and have half of them wear a shield and see who gets infected more. It's unethically not doable.
Right. It is a real challenge, I think, communicating this kind of uncertainty. And I have heard some public health authorities say, well, we've got to be clear, we've got to be definitive, or there's not going to be uptake of the suggestion, whether it's mask wearing or physical distancing, or whether we have to be kind of really clear and strident in our language. Otherwise, people are going to feel confused. And I don't believe that. I think we can be, as you just said, Emily, with what you're seeing in Ottawa, we can be honest about the science and still have this uptake. Let me give you one example with masks. I worry that masks are being pushed so hard and so dogmatically, and almost like it's the science is so clear. They're comparing it to vaccines, that if you don't do it, it has all these consequences. Now, I'm 100% pro mask. I think we do need to do it for the reasons that we've just talked about. But if you have that dogmatic position, I worry that people are going to say, well, if we use masks, then we don't need physical distancing.
Well,
if we use masks, we're going to be able to open up faster.
Yeah.
If we use masks, everyone can go back to school. Here's a good mask.
There we go.
I'm going to check my mask. Check my mask. How's that for a Go Science mask?
That's great. That's very good. Now, I'm the only one now that's missing it.
But, you got to, I think we need to talk about masks well. Yeah. And we've got to talk about masks in a manner that allows the science to evolve.
No, I mean, we're not going to have people going out to clubs and everything is okay because they're wearing face masks. I mean, that's ridiculous, right?
It is interesting because you're hearing some on the right adopt it that way, right? Pushing masks. What a paradox, right? They're pushing a mask to get across a different agenda.
Which mask? I mean, do we wear the one that I just had, or do we wear this one, or the 1,000 other varieties that are out there? How do you know? I mean, it's almost impossible to study these things, but at least there's evidence accumulating that
now I have mine.
Epidemiologically.
There you go.
There.
When you look around epidemiologically, you see that areas where people have taken to wearing masks, you have fewer infections. Right?
Joe, what do you think? The simple calculus I always use with masks, and I think this works for a lot of things, is scientific plausibility. And I think there's scientific plausibility here.
Yeah.
Plus emerging evidence, from using a variety of methodologies, plus other social considerations like symbolic value, like the idea that there may be particular conditions where it's the risk is so heightened that you want to use the precautionary principle. I think you put those together, right? Scientific plausibility plus emerging evidence plus other kind of social softer considerations, and it equals wear your masks.
Yeah, scientific plausibility is an important factor that people don't speak about enough. We have learned a lot about the way the world works over the last, few thousand years, right? And there are some things that we can dismiss without having to study it. just because we know how the body works. We know things. And there's this ridiculous product that I'm sure you've seen, Miracle Mineral Solution.
Oh, yeah.
Okay, which is being hyped. And finally yesterday in Florida, they had an injunction against this church.
I saw that.
Yeah, that was selling this thing to their parishioners. This is ridiculous. I mean, we know what this is. It's basically industrial bleach that you make by mixing together two chemicals, and we know that this cannot possibly work. You cannot drink bleach and well, I suppose you'll get rid of some viruses in your body. You drink bleach, but you'll be getting rid of your body as well, right? So we can dismiss this just based on prior knowledge, right? But it's so easy to convince people who don't have that kind of knowledge that there's this secret solution that is being hidden by this unholy alliance between government and big pharma, etc. And people buy into this. It's scary.
Well, normally you also don't have. Okay, I know he's not our president, but normally you would also have some type of figurehead that is still for science or for backing the experts or going to the experts for this, as opposed to someone who's kind of rallying the troops against. I mean, I feel this is a very unique moment in history for that.
Yeah, and it's what that does is, it really polarizes the public discourse, right? So what he's doing, and again, a little evidence to back this up, not only is he going countering science, right, but he's labeling certain positions, being for hydroxychloroquine, being against masks. He's kind of signaling that these positions have an ideological component to them. And so therefore, if you are in my ideological camp, and if this is part of your personal brand, then this is the behavior that you should adopt. And the real challenge, and there's interesting work from other areas that highlight this, the real challenge is if you adopt those beliefs, if it really does become part of your personal brand, it becomes very difficult to change people's minds. There's a really interesting study. It was a small study, it was a qualitative study, but I think it has intuitive appeal, where they studied why people, the people's views of alternative medicine as to why they use it, right? Joe, I don't know if you saw this study. So what they did is they found that often people do go to alternative medicine because they're looking for efficacy. They want something that's going to work, right? Or perhaps they've been frustrated by the conventional system. They weren't listened to. So they have these sort of more objective, kind of understandable reasons why they're drawn to alternative medicine. Something we can all relate to. They want something that works. But once they get there, they start to adopt the ideology behind it, and it becomes more of a philosophy for them, right? It becomes more part of their personal brand. And I think we're seeing and once that happens, again, it's very hard to change people's minds. But I think we're seeing that with the COVID debate, right? All of these COVID topics, you're starting to see that same kind of migration happening into the justifications for their positions. So I think as science communicators, you want to get to people with the truth, or at least with critical thinking skills, early in that migration process, right? You want to get them when they're still sort of forming their views on stuff. And again, this is about engagement. This isn't about talking down to people. This isn't about a unilateral kind of discussion. This is really about trying to have, listening to people and engaging them with critical thinking skills.
One of the great scourges for us as far as communicators is cherry picking.
Yeah.
Because there's so much stuff that is published, even in the peer-reviewed literature, that is essentially garbage.
And now we have predatory journals, right, Joe?
Absolutely. So you can back up virtually any view that you have by cherry-picking data, which is exactly what we see now in the U.S. Yesterday, Pence has this press conference. Says, well, we're really doing well because the death rate is going down. Well, this is not a measure of how well you're doing. You have 60,000 new cases being reported every day. Well, yeah, maybe the death rate for now is going down, but wait until these 60,000 get to the stage where they're dying. Let's look at this in a couple of weeks. So they pick this one little piece of data that the death rate is going down to claim that the U.S. is doing well and that they are the model for the world. The world is looking at them. Well, yeah, the world is looking at them and ridiculing what they are doing.
Right.
So,
right.
I mean, anyway.
Well, cherry picking is such a frustrating phenomenon, across the board. And Joe, we see this all the time in alternative medicine also, and it also goes to the kinds of studies that people turn to, right? That people always need to be reminded again and again and again. Rarely is one study going to be enough to dictate policy. Almost never is an animal study enough. Almost never is one observational study enough. Look to the size of the study. Understanding what a powerful study is versus what an anecdote is, what a testimonial is, what a bad data is, I think matters. And that's another kind of science literacy that we hope that we can communicate to the general public.
Yeah, and there's also the human biological diversity that you cannot apply the same treatment to everyone, even if they have the same condition. I mean, we see this all.
Even with diets, that would be right. Diets and nutrition and losing weight, everyone's different.
You can take 100 people and spray the cold virus in their nose, and they will not all catch the cold, right? Why? Well, you can, blanket statement, their immune system difference, right? But we don't really know what is going on there. The immune system is so complex. I mean, now we're seeing, with COVID, all of these claims, you've got to boost your immunity.
I know.
It's crazy. Yeah, right.
Joe, this is one of the topics that we're really focusing on is immune boosting, because you're right. It's such a great example. It's such a great example of the noise that's out there and all these products. And, even Tom Brady, my idol, he's selling immune boosting nonsense. It's really everywhere. And it's a great example of, it has a lot of intuitive appeal, right? It's a message that has a lot of intuitive appeal. There is no supplement that can boost your immune system that's going to protect you from COVID. People say, what about vitamin D? Even there, the evidence isn't clear. But the bottom line is, you don't want to boost your immune system. That's an autoimmune disease. That is anaphylactic shock. The immune system is ridiculously complex. But one of the interesting things about immune boosting, and one of the reasons we decided to study it, is we've seen this really interesting pop culture evolution. It's being used so much. It's almost like the immune boosters, you guys have won a little bit. The phrase has been used so much that it's has a health halo around it. Mm-hmm. So people will say, go out and get good exercise so you can boost your immune system. Get a good night's sleep so you can boost your immune system. So you have, yes, get a good night's sleep, because that is a healthy thing to do. Yes, exercise, but you still can't really boost your immune system.
No.
But you'll see reputable places like Harvard or reputable health journals use that kind of language because it has so much pop culture uptake. And the problem is that gives legitimacy to that phrase and allows people to sell the bunk, right? So I think it's a really problematic trend.
That's one of our. That's a challenge that I was just talking about last week, and especially with our office, it's very easy to kind of produce that type of language, but we can't produce that language when we're also criticizing it from other people doing it, because we know that it has that response, that it has the click. People will do it because they're interested in that. Basically, it's appealing to pop culture. It's not science.
Because there is something to it. I mean, we do have an immune system, and it does ward off bacteria, and does ward off viruses. So it kind of is logical to think that if somehow you could make it more efficient,
it's not a muscle, though, right?
Yeah, but one thing that I find works is to give people the rope to hang themselves by asking questions. Say, all right, you're claiming that you take this substance and it's boosting your immune system. How are you measuring that? What would you want to measure to show that your immune system has been boosted? And then say, oh, well, what is that? What is the immune system really? You make them think about it, and they will eventually, if they're reasonable people, being posed the right questions, you can lead them down the right path.
Joe, we did a study, and this isn't. I have to make sure I qualify. It's still in preprint. It's a study. I don't want to be part of the hype problem, but we did a study where we looked at. We were trying to sort of pretend the methodology is that we are people searching for immune boosting, right? So what we did is we looked at over 200 websites that would be found using search engine on the term immune boosting. So over 200, and then we did a content analysis of those websites, and I believe it was over 85% of them present the idea of immune boosting as real and as legitimate, and as a way to prevent or cure COVID-19, right? So that's incredible, right? So that's what people are getting. And listen to this, only 10% of those websites had any kind of scientific critique, like the kind that you just said, Joe, about the concept of immune boosting. So, a really sort of problematic trend. And we also we have another study that is we're still have to be careful because we're still doing it. It's still unfolding. But where we looked at Instagram and how it represents immune boosting. And I think it's really important to look at these different platforms and how these different platforms portray stuff. Because as you guys know, Instagram is much more visual. Mm-hmm. It's a little more frivolous. I think it's fair to call it that, right? And I've looked at hundreds of posts on Instagram, stories and posts on Instagram, and not a single one, you guys, not a single one represented immune boosting in a critical fashion or in a scientifically accurate fashion. So that's, it's really incredible. And that's what people are seeing now. That's how people are getting exposed to this stuff.
And they're seeing it from people who sound legitimate. That's a problem. Sometimes they're physicians or scientists, researchers who are pushing these things. I just viewed a video that someone sent me. I mean, people send me these videos all the time and you ask, is this true? The answer almost always is no. And they were talking about telomeres and how, you can live forever if you just make sure that your telomeres are in good shape. Now, of course, there's a lot of very legitimate science around telomeres. A Nobel Prize was given for the study of telomeres. But we know virtually nothing about lengthening them. Or
maybe it causes cancer, Joe.
Right. Or preventing them from unraveling. We don't know. So this video it was about 3 minutes. And the first 2 minutes were very legitimate, talking about, what telomeres are and, usual analogy of the shoestring and,
the caps.
The cap, the shoestring. Very well described. And of course, he's wearing a lab coat and then has the obligatory.
Of course.
Right.
around and describes all of this very well for about 2 minutes. And then descends into the pit of ignorance. By talking about some plant extract that they are selling that can lengthen your telomeres, that increases telomerase, the enzyme that makes them, and etc. There's no clinical evidence for this whatsoever. There might be something in a cell culture, but the human body is not one large test tube and not large petri dish, But you have someone here who seems authoritative, and I'm sure that people will buy into this product. And that's the thing, that when legitimate doctors or researchers go astray, they can do a lot of harm. I don't know if you saw in the last couple of days another video circulating from Texas. This doctor in Texas who claims that he's found the answer to COVID, and it's Pulmicort. It's asthma.
The puffer.
Yeah. And that he's been nebulizing this like he was doing for asthma patients, and all of his COVID patients are doing much better. And he speaks a very good game, and you can't really dismiss it. Maybe there's something to this, but don't talk about it until you have more than anecdotes. If you have done some studies on it, yes, go and publicize it. But just to say that, I found the answer, and which is exactly what he says, you know. And
but the answer, even the answer, there's not even when there's a vaccine, there's not going to be one vaccine. There's not an answer that you could get for this.
Well, it is amazing. The first thing you talk about, how scientifically legitimate things look, and it is getting more difficult to tease out the real from the unreal. We've talked about this in the past. This phenomenon I call Scienceploitation, right? Using sciencey language in order to get across bunk. And in that study that I just referred to, where we were looking at immune boosting, I want to be careful I don't misrepresent my own data. I think it was over 35% of the websites refer to microbiome research, right? So you just roll out that language, the microbiome, it sounds, and people have this vague idea, oh yeah, I've heard about this microbiome research. It's cutting edge stuff. This must be real. So you got the sciencey language, and then you do the second thing you just referred to, Joe. You have a testimonial, you have an anecdote, right? And research tells us, there's really interesting studies on this, that a good anecdote, a good testimonial will overwhelm our scientific thinking, right? Our critical thinking. And these people who push bunk do it all the time. They use those two things, right? Scienceploitation, and they leverage narratives, stories, testimonials to make their product or their idea sound compelling. And unfortunately, you guys, the evidence tells us that both of those strategies are really effective.
Oh yeah, emotion beats science. We've seen this, and unfortunately, malignant narcissism trumps everything else.
So Tim, you said you were looking at Instagram and looking at hundreds of posts and stories and everything. So tell us about some of your studies that you're doing now, also a little bit more specifically, because some of yours are actually meant for social media, also. To get
that's right.
You're getting into the game.
Yeah, that's right. We're trying to come out the misinformation in the context of the coronavirus from absolutely every single angle that we can, right? So we're doing empirical research on how this is being represented, and we are when we put in the grant, our idea was that this is funded by the CIHR, by the way, and some other wonderful funders. So thank you very much for that. But our initial methodology was we were going to look at how it's being represented in the popular press, so the traditional news media, how it's being represented on social media, and how it's being represented when you do a search engine search, right? And what we found with that first one is our initial research showed that the news media has actually done not ideal, but a pretty good job. They were not, I think very early days, the traditional news media recognized this is serious, and we've got to be careful how we're going to report it. Now, look, it's not ideal. I can give you a lot of examples of them doing a bad job, but I've been following, as you guys know, the news media for a long time, and often they really bungle it, right? They really do. They've done a fairly good job here. But social media, holy cow, we found misinformation everywhere on social media. We're doing a huge study, over 1 million tweets of hydroxychloroquine and how that's being represented, and following who are the spreaders, no surprise there. And then of course we're looking at search engines. So we're doing that. But the other thing is we're working with a wonderful interdisciplinary team like Gordon Pennycook at the University of Regina, who's actually doing empirical work on how people respond to this misinformation. Awesome. And what we have found is, in other research, this replicates other research, that if you can just nudge people to think about accuracy, nudge people to pause, to consider the truth of a document, you can actually slow the spread of misinformation. Now, it's not ideal. We're just talking about moving the needle, but you can have an impact. So what we've done is we've taken all that work we're doing and we've informed our own social messaging, right? So we have an ad campaign that we worked with Media Smarts, this great group that does public health messaging that are about media literacy. And we've created our own campaign. It's called Check, Then Share. Yeah. So if you just Google Check, Then Share, you'll find this. And it's just to encourage people to pause before they share. This is how everyone can become involved in this.
Even if it's just that little I'm not 100% where it's coming from, I'm not going to share this one. That's a win.
That is a win. That's a win. Because social media is so frantic. It's this place,
it's
it doesn't invite.
All you're doing is liking and sharing and liking and sharing. That's it.
Yeah, it doesn't really invite reflection, right? So we're trying to invite people to reflect a little bit. Yeah. And then, as you know, Emily, the other thing we've done is we've created some great images, that we hope people will steal from us and share.
We're gonna tweet more of those and share some of those. Yeah.
Yeah, awesome. That really try to summarize the data, that we try to make this evidence-based. And then, of course, we're trying to do a lot of op-eds. And the other really cool thing that we're doing is we're working with my brother, who's an art professor, and he is working with his wonderful community to create art, to create fine art about the spread of misinformation. And of course, you got to remember, fine art is also about commentary, right? So this is not just as a way to get across information, but also a way to invite people to think about the problem, right? And so some of this is challenging art. It's challenging art. And the wonderful thing is that both Sean and I are part of the Royal Society of Canada's committee that's been put together to respond to this. So Sean's and his colleagues are going to use their art to illustrate these complex problems that we're all facing in the context of COVID.
We have a question on Facebook, and I was going to ask the same thing. Where and when will we be able to find some of the art? I mean, the images I'm going to tweet, the ones that with your project, and some of the art stuff. When is that going to be coming out?
So I have been tweeting some of my brother's stuff, so you can see some of that stuff online. I will, and I'll tweet out another link that has other images. But it will also come out when more of the Royal Society work comes out, which will be rolling out over the next couple months. Okay. Sean has also had a recent show, and it was going to be a live show. It ended up being a virtual show. I can also tweet that has some really great art, and you guys, it has some great graphic illustrations, a graphic, sort of like graphic novel kind of vibe to it. Some really compelling stuff. But again, a lot of this is just really get people thinking about it, get a discussion happening.
It is very interesting. I just realized the way that you said that we are in this age of misinformation. And I guess, I try and fast forward, 50 years from now, 20 years from now, when people are looking back at this, 2020 time period all of a sudden, and it's the age of misinformation and what to do. But it's also the age, hopefully, of countering misinformation. And then what did the other side do to help with that? And you're really creating us together, a body of work to do that, hopefully. So
it is incredible.
Really, maybe around 50 years from now to see what happens.
But actually,
telomere.
But one issue that keeps coming up, and I'm sure you hear this too, is the comparison of COVID-19 to the flu, and the people say, look, we have thousands and thousands of people dying every year from the flu. We never made people put on masks. We never, worried about all of this. And now all of a sudden we have this different virus and the world is going crazy. And this is a constant argument that, that I hear, that this is just being overplayed. Why didn't we worry about all of these thousands who were dying every year from the flu? And all of a sudden, we're going crazy about this. I'm sure you hear this all the time too.
Every day. Although it's starting to dissipate. I definitely heard this a lot early days, but those comments are starting to decrease, and I think partly because the sheer numbers, right? The sheer numbers that we're seeing. But Joe, they are different. First of all, we don't know as much about it. Secondly, the numbers are, think of what's just happened over the last couple of months globally as a result of this pandemic and the deaths and the infection. So they are different there. As you guys know, the infection rates are different. The transmission is different. But the other response is, we do worry about the flu.
Yeah, right,
we really do worry about it. In fact, we don't worry enough about it. We do need to, we talk about vaccines and how important they are. And people ignore that. So there's a whole bunch of reasons why that argument doesn't work.
And of course, these things are not mutually exclusive, right?
Right. We can worry about both of them.
Well, we have a question, for example, on YouTube that says, should everyone worry about COVID-19? Doctors say 80% experience just mild symptoms. So those who have serious problems, those who with serious problems have comorbidities. But yes, we should all worry about them because every person reacts differently, right? I was just told that someone I know who's 80, who's getting over lung cancer, literally was completely asymptomatic from COVID. He got a test and he had COVID-19. He had no idea. And he's someone who could have really ended up on a ventilator almost and didn't. And then other people, who are perfectly healthy athletes in their 30s or whatever, did end up on a ventilator. So I mean, everyone should worry about it and wear the face mask and respect social distancing.
Everyone should worry about it. And the flu analogy, I think, is really important here. Everyone should worry about it because you aren't necessarily worrying about yourself or your family.
Right.
This is a community problem, right? You wear a mask, and this is one of the reasons the messaging is tough, is the primary reason you wear a mask is for other people, others. Right? You're doing it for others, not to stop yourself, although there's starting to be some evidence that helps you too. But really, at the core, it's to help other people. You're physical distancing to help other people. You're doing all of these things for our community because we're in this together.
And that's also a very big difference between America and Canada. Because when you look at healthcare and, the foundations of both of our countries are extremely different, right? Theirs is like life, liberty, and the pursuit of happiness, and ours is, and I don't know them right now, but it is about it's about the collective. It is about, collective healthcare and looking out for other people. And I know that, some people might not follow or whatever, but our countries are founded upon those principles, and I think that is a lot of where that comes from. So,
well, the other ludicrous comment Trump made the other day is that 99% of the time, people who get COVID, it's a nothing. Well, it's not a nothing, because now we are learning that even people who have had very mild symptoms can have complications later on, and that even those mild symptoms don't go away. And, so just because someone seems to have beaten it doesn't mean that they're safe.
Yeah.
So we're learning more and more about this disease and how it affects everything, right? And at the beginning, nobody knew about the microthrombi. It was a mystery. How was it affecting the kidneys? How was it affecting blood vessels, when it's a respiratory virus? Well, now we're learning more and more, and the more we learn, the more we see that you're not out of the woods, even if you've had a very mild case.
Well, do you want to just comment? We also have a question here on Facebook, and it was a lot in the news a lot this week because the WHO and aerosols, right? Can you just comment, Joe, a little bit on that? Maybe both of you, just to bring us up to speed on what's happening with air. Talk about evolving science.
Of air transmission. Well, of course, it's air transmission. No matter what, whether you're talking about droplets or just the virus itself, it's going through the air. The question is, how far does it travel? And what we now are learning is that at first, you're expelling these droplets, which are mostly moisture with the virus embedded in it. But then as the moisture evaporates, you're left with smaller and smaller and smaller particles. And now it seems that they're traveling further than originally thought, because information is accumulating about this. I mean, I don't think that we should be surprised when we look at some of the evidence, funerals, where one person, infects the whole crowd, or the choir story, where one person infected the whole crowd. Well, how did that happen if it wasn't through air transmission? So, of course, it is being transmitted. The question is, how is ventilation affecting it? Exactly how far, whether it's an infective dose or not. Just because you do virus doesn't mean it's an effective dose. But yeah, I mean, it is being transmitted further than we thought.
It is interesting. If I could comment on this too, Emily, because I think it's a really important point also to the nature of science. All right, so people are watching this, and I joke in my op-ed that's coming out is that people are watching science more closely than they have in a long time, and they're seeing the sausages being made, right? And they don't like what they see. But as Joe knows, these kinds of vigorous disagreements among scientists are the norm, right? It's the norm. It's not different. The World Health Organization doesn't have some kind of nefarious goal to suppress science. They're looking at the data, and they are coming to a conclusion. A group of scientists disagree with their conclusion and feel that they should be more cautious in their interpretation. That's how science works, right? And as everyone probably knows, I think it was yesterday, the World Health Organization actually said, okay, we're going to revisit our position on aerosols, and we're going to see if we need to tweak our position. I suspect they're going to, Joe. We'll have to wait and see what they do. I suspect they're going to come in somewhere in between those two positions. But that's the way that science works. That's the way it's always worked. It's always been messy. It's always been contested. And you kind of want that to happen, right? You want that to happen so we can nudge ourselves closer to that shifting truth.
It just doesn't normally play out so much in public discourse on an hourly basis. You know, it's in the background and we leave it to the scientists, and eventually they present, you know, it for us kind of after the consensus has been reached. And right now, that's what we're seeing.
Observation is that these people who diss science and, you know, talk about the pharmaceutical companies not doing, you know, the proper job, etc. But on the other hand, they expect science to give them all of the answers. So on the one hand, they're criticizing it, but they also expect science to be providing the answers, and they're criticizing it for not providing the answers.
And when they get an answer that fits with their ideology, they're the first ones to tweet it out. The first one, hey, wait, I thought science didn't work.
Confirmation bias.
Well,
you know, cherry-picking and confirmation bias, bane of my existence.
Tim, you said, I think it might have been not live, but before we chatted, that that you had thought that maybe this, I mean, and I thought this as well, that the coronavirus all of a sudden would kind of spike and increase trust in science. And you've seen that, you know, this actually didn't, and based on your research and everything. But I'm curious, all the Instagram and tweets and everything that you've seen, if there was a difference from March to now, because I actually felt that everyone was like, oh my gosh, we need a vaccine and let's get a vaccine. And I was like, this is the end of anti-vaxxers. Like, they're all going to want this coronavirus. And then time happened and people started thinking. And again, it just kind of gave more space for misinformation to enter, right? Like when Joe says, when there's a void in the science, in scientific discourse, then that's where the pseudo can come in, you know? So I'm just curious if there was something from March, April until now where all of a sudden we saw trust in science decrease. I don't know if you looked at timestamps or anything, but. Yeah,
so there is, that is my biggest concern, right? That we are going to see this continued erosion in trust. Now, there has been some interesting surveys that have happened in Canada that have shown that in Canada, if you ask Canadians, they will say they trust scientists, they trust public health authorities, they trust academics, and but there is indications that even in Canada it's become more polarized. Now, there was a fascinating study from the U.S. that showed how incredibly polarized their discussions are around this. You know, the things they talk about, what they share. It's, you know, the political divide is clear, right? There's really, really strong polarization. So we want to avoid that, right? We really want to do what we can to avoid that. But the numbers in Canada are also not great if you look at who believes in conspiracy theories, right? It's incredibly high here, higher than I've ever seen, right? You know, one study from Carleton, Josh Greenberg and his colleagues did a really fascinating study. They found about 50% of Canadians believe at least one of these conspiracy theories, right? And there's harm associated with that belief system, right? There's real harm associated with it.
Sure.
And the other depressing thing, and you touched on this, Emily, is the vaccine stuff. You know, you look at the numbers around, there was a study that came out of the UK just a couple of days ago. There's a third of the population there said they won't get it. There was a study in the US that found that only 50% said they would get it. And then there was a breakdown in confidence with the other 50%. You know, those are really grim numbers, right? Those are real, because you layer on top of that, you know, the usual things that add to vaccination hesitancy, you know, convenience, you know, fear of needles, you know, all those other things that drive people away. And you're looking at a far less than ideal uptake and interest in these vaccines.
Yeah.
Well, I certainly thought at the beginning of this that the anti-vaxxers would be shot out of the sky, because, you know, I was saying, look at the world. This is what it looks like when you don't have a vaccine.
Yeah.
Right?
But they found a way to come back strong.
And in spite of all of this, they're maintaining their position, increasing their venomous attacks on vaccine. I mean, it's
stunning.
It's totally stunning. Although I think because we are in this business of being very sensitive to this and we see it everywhere, I think it's probably not quite as extensive as we think that it is. It's sort of like the squeaky wheel gets the grease. We're seeing all the squeaky wheels, you know, but they're
I hope you're right, Joe. You know, even looking at those grim numbers, you know, I'm hoping that beyond, because the ones that say no, I'm absolutely not going to get it, are still relatively low. You know, in the 10% and lower level. It's that one in the middle, as it always is the case, right? Those hesitant ones that we've actually talked about at one of your events, right?
Yeah.
Mm-hmm.
That's not, and I'm hopeful. I always try to be optimistic that unlike the flu vaccine and unlike some other vaccines, that the error is actually in the opposite direction. And when the vaccine actually rolls out, those ones that are hesitant are going to go, man, I'm gonna get this. Let's make this happen. So I'm hoping. Let's be optimistic.
There's too much optimism about the vaccine. We're going to have a vaccine, by 2021. There will be many vaccines that will, come into play because so many companies are doing research on this. But just because the vaccine exists doesn't mean that we know it's going to be effective. We won't know that for years. So people think that once there's a vaccine that is out there, that our problems are over. No, that's not the way that this is going to work. The vaccine is not the ultimate solution to this, because first of all, even the best vaccines don't work, 100%.
It's not, and it's probably not going to be like the measles vaccine, which is incredibly effective, right? Thankfully for this really infectious, it's going to probably be more like a flu vaccine, right?
Flu vaccine, maybe 70% efficacy or something like that. Anyway, we're coming to end of our time here. And Tim, let me ask you this final question, because this is what I like to ask, even when I have guests on the radio, when you have people who seem to know what they're talking about. You seem to be in that category. What have you done since the beginning of this in your personal life? What have you changed? Or what are you abiding by? And what do you think is excessive?
Okay, so my three. So this is just like a personal thing. It's a personal thing. Like, just how's my life changed? Things that I've adopted that I like. I've started walking. Emily, I know you're a runner. I'm always like this super intense. It's got to be intense. Yeah. You got to be all in. It's got to be an interval, or you got to be squatting. I just go for these long walks, and I love it. So that's one thing. Second thing, Scotch. I discovered Scotch, so that's a bad thing. So are you Scotch?
You're going on long walks and you're an alcoholic. No, I'm just joking.
I'm that path too, because I have two sons-in-law who are into Scotch, and they know about it. So they're trying to convince me, and I'm at a point now when I can tell the smoked one from the other one.
Oh, yeah, that's right. Or Petey's the big term.
No, it is. There's been some nice silver linings or reflective moments you're a very go person, right? This has probably forced you to kind of take some time and smell the roses a little bit, be with your family, do those long walks, just take a little bit of time for yourself also.
What have you done about travel?
So travel's been weird for me because, as you guys know, I've been on the road, like almost nonstop. We're talking weekly for 15 years probably, right? 15, 20 years.
Yeah.
So it's been weird. And first I loved it. And then I hated it. I wanted to be out there again. And now I'm back to, what? This is okay. Bring on the long walks.
Last time you flew?
It was in right before the event, March 11th. And interestingly, I was supposed to fly to Toronto to work with a production team that I work with to film some teasers, for a new show that I'm working on. And that was shut down. And it was weird because, I was talking to our producers and thinking, this probably still going to happen. And it was like right up to, what, don't come. And so it's been weird. I haven't flown since then.
And what
would you?
Yeah, would you?
Fly?
I would, but I think it would have to be for a good reason, right? I think it'd have to be a good, not some more frivolous reason. But Joe, I haven't had to face that question. No one's asked me that before, and I think it would depend. I think it really would.
Actually, the air on the planes is actually good, the way that it circulates, because it goes straight down, doesn't go sideways, so it pushes everything down. Plus, they're making people wear masks. I don't think that is quite as dangerous as people think.
But who knows? And you're also there for extended periods of time on a plane. Whether it's a half hour to Toronto or 8 to Vancouver, you don't know. Yeah.
What about socializing? Would you socialize indoors with people who are not your immediate family?
So we went to our first dinner, my wife and I, went to one of our favorite restaurants in Edmonton, and I thought they did an excellent job. Everyone had masks on. It was socially distanced. I was impressed with it. It was odd, you know. It was didn't have that same kind of vibrant feel you're used to when you go out to dinner, right? But I thought they did a great job. And the other thing that we did very recently, just this week, is we actually hosted the Edmonton Symphony Orchestra on our porch.
I saw on Instagram or something.
Yeah, that's right.
Yeah.
And what it is, it's a fundraiser because musicians are really struggling. So
Yeah.
what we did is they played. It was a quintet. It was Schubert. It was amazing, like a really special moment. But what we did is we socially distanced. We had chairs, lawn chairs out, spread out. It was magical, you guys. So I think there are ways that you can do this. There are ways that we can still have fun. We can still get together, and we can do it responsibly.
Yeah. Yeah.
And we don't have to pay $1,000 to watch Hamilton.
That is,
$1,000? That's a deal.
yeah. Yeah. Yeah.
Okay, well, I guess that's it. We've used up this hour. It flew by very quickly, as it always does with Tim. We'll have to do this again after, we learn a bit more about this and see what else we can diss. Okay.
Well, we'll be back. We'll be back next Thursday at 12 with national health reporter at the Globe and Mail, our friend Carly Weeks, also. So, yeah.
Thanks, Tim. Thanks a lot.
Thank you so much, you guys. Keep safe.
Thank you, Tim.
Keep safe.
Bye. Take
Bye-bye.
care. Bye.
Bye.